Yeah, shall we start the recording? Thank you. First, apologies for absence.
Apologies from Suzanne Lamb, Liz Morgan, Rick O'Farrell, Graham Writer, Guy Renner-Thompson, and Jeff Watson.
Thank you. Okay, let's go through the minutes of the meetings. If there are any corrections or mistakes, please let me know. I went through that for the full council meeting. It was accepted as a version. So are there any suggestions, corrections to be made? None. Thank you. Are there any disclosures of interest for this meeting, given the agenda items? None so far. Thank you. Now, there's a small minor change in the agenda items. The agenda item 4, living with COVID, just an update. That will move after agenda item 6. So we move on to item number 5, integrating services supporting children and young people. I think Jill O'Neill is going to update us on that one. Thank you.
Thank you, Chair. Good morning, everyone. So I'm Jill O'Neill. I'm Interim Deputy Director of Public Health, and as you've already heard, Liz Morgan wasn't able to make it today. So I've got some slides to go through for you in relation to this agenda item. And that's because originally this report was written for the June Health and Wellbeing Board, but when that was stood down, this paper is now slightly out of date, so the slides are the most up-to-date information to share with you. I really just want to highlight that this is an early thinking report for discussion this morning. And really, it is to provide context in relation to the approach that we could take around how we progress our children and young people's integrated system model. And it's just to highlight that this is building on a huge amount of work that's already been taking place across the Northumberland system. So we have Best Start in Life as a core priority and pillar within our joint health and wellbeing strategy. We do have our Children and Young People Strategic Partnership. And then we also have our emerging Inequalities Plan, which is going to be all around community-centred, place-based approaches. And that's going to be coming as a high-level report into the September Health and Wellbeing Board. And then we've also got the newly emerging integrated care system and creation of the place-based board as well. And partners may want to contribute at the end of this because we had a workshop just yesterday afternoon, and this conversation took place there as well. And then what I won't get into the detail of verbally, because there's a lot of context within the report, is the development of the family hubs model, which is the evolution from Sure Start to children's centres to family hubs, being led by Anna Freud Centre nationally, and that's moving from 0 to 5 to 0 to 19 and 25 for children and young people with SEND or care leavers. So there's, as I say, there's a lot of detail within the report around the terms of reference and the key areas of interest for family hubs. And then also the other main area within the report is the Healthy Family Partnership Board, which is the Section 75 partnership agreement between the Council and Harrogate District Foundation Trust as our 0 to 19 provider. So as you can see, there's a huge amount of work underway already from a governance perspective for children. So the aim that we're proposing and that we'd like to take forward as a system is to look even more closely how we seek to improve our life chances for our children growing up in Northumberland and take a much more closer scrutiny at that gap in inequalities that are faced from a health, social and educational perspective. And what I'm going to share with you briefly this morning is to highlight that these changes that we are proposing aren't a quick fix, and that's deliberately so because this is all about further relationship building and the context of quite a lot of changing infrastructures that we're seeing nationally, regionally and locally. And what we really want to highlight is actually the agency of our families in all of this, and what is it that families and young people can do for themselves, what is it that families and young people need a little bit of help with, and then what is it that we as agencies can do for our families. And ultimately this is all about a think family approach and putting families at the centre of everything that we are considering and working better together to do that. So again, it's in the report if you've had time to read through it. Why do we talk about the term integration? It's bandied around quite a lot. Could also be collaboration. But what the evidence shows is that there can be improvements in reducing the inequalities when we work better together. It is about that putting the family at the centre of all we do. It absolutely can improve service user experience and ultimately value for money as well, and efficiency across our systems and our organisations. And when we do look at the evaluations, what we see is there's been a lot of work undertaken around older people, frail elderly, but less so in the integration of children and young people and families work. Beyond health and social care, we're really particularly keen to link in with education and schools, libraries, housing, and those conversations are starting and they're going well, because these are the places where our families and our young people live, work, socialise. So it's taking that broader perspective for us. And we're really keen to evaluate what we want to do in Northumberland to add to that evidence base, but also to very much focus on culture change, because that's where we think the heart of this improvement exercise will be. So yes, we do have a number of metrics already in place in the Joint Health and Wellbeing Strategy and Children's Strategy, but actually what are the few key measures that if we undertake this change and culture leadership journey over the next couple of years, what are our aspirations for a child born in 2024 and what will it look like for them when they turn 6 in 2030 or a teenager turning 16 in 2030? And actually, this is all in relation to how we close some of those gaps that we have from that inequality perspective. We know, for example, that some of our areas have got up to 42% of children living in poverty, for example. So it's some of those discrepancies and disparities that we're really keen to try and address, and we can only do that together. So there's a lot of information on this slide, and again, it's in the report, but really just to highlight how far do we want to take integration, because there's already a lot of effective signposting taking place. There's already co-location happening within the family hubs and within health clinics and within schools and such like. Is it about service delivery and pathways, or is it actually about what we do with the Northumberland Pound and how we best share and deploy our resources to best effect, working with our children and families on that co-decision and journey. And as I mentioned before, and you've had the information around the summit, and we'll be receiving the report in September on the Inequalities Plan. The interface is absolutely critical on the children's integration work and what we're trying to do with the Inequalities Plan. And it is about improving our data and our insights, looking much more cohesively around our community-centred approaches from that neighbourhood level, and actually thinking about what is it that we need to leverage more around our civic level responsibilities. How do we best enhance our services to reduce unwarranted variation? And then, as we keep saying, what is it that can communities do for themselves? So when we start to think about children's integration, it's really complicated. It's a complex picture because we want to move beyond the health and social care system as standalone. So what you can see is the immediate circle that we are already engaging and working collaboratively with through the Healthy Family Partnership Board, but we're really keen to understand that wider system interface and take stock of that all the strategic boards that consider children, young people and families, and where best to look at that and how we best grow the relationships, bearing in mind it isn't just about physical places, it's very much around virtual and digital, as well as the wider community offers such as leisure centres and libraries. So why do we want to start from a culture and leadership perspective? Because we already have a lot of plans in place, we have a lot of performance measures in place, but what we know from talking with staff on the front line and with our families is that we'll be much better if we have shared values and shared behaviours, because that's what ultimately takes us towards that shared culture and vision. So that's where the evidence tells us, and it's also what we feel is intuitively the right thing to do. We know that if we've got strong relationships with trust at the heart, that's where we can have challenging conversations. And we've started to look at that, and we've had an initial workshop with senior key leaders, and we've really just scratched our heads and started to think, well, what hopes do we have for integration? What can it achieve for us? Where are we at with our shared values, and how will we measure success? And we absolutely know that's not just about senior leaders coming into the room, that is about middle managers, it's about frontline staff, but it's very much around our families and communities as well. So the next steps and actions for us is to test ourselves ourselves in relation to how mature we are to take this forward and to develop a collaboration charter that isn't just a piece of paper. It's got real meaning and traction for us. When the going gets tough, we can look at this and think, actually, we do have shared values. We are working towards the same goals. So that future state is to be determined, but it is about building on the family hubs, because there's great work already there and there's so much good practice already happening across our communities. But actually, how far do we want to take this journey around joint commissioning, for example, joint risk sharing and joint leadership in everything that we do? So that's the premise of the report. As I say, it's an early concept report, and these are the recommendations, Chair. Thank you.
Thank you very much, Jill. It's a very interesting presentation. Quite a lot of objectives, laudable ones like addressing inequality, and then multidimensional integration, and then you have laid out lots of starting points, food for thoughts. Now, are there any questions to Jill at this point? Yes, Wendy.
Thank you very much, Chair. Thank you, Jill. That was interesting, and there was a lot in that, so thank you for that. I was just interested in the child born in 2024 and the following data on that. How will that be done? And what will it be across the county? Will it be selected areas of the county?
That's a really good question, thank you. So what we're really interested in is that child born in 2024, and we've got key measures, and I'm conscious I've got Harrogate colleagues in the room. So things like school readiness, for example. We've got nationally standardised data called the Ages and Stages Questionnaire, ASQ, and that measures how ready a child is to go to school, from relation to their physical literacy through to their speech and language. And we know that there's a lot of variety across our county in relation to those that are meeting that standard and those that aren't. So what we'd like to do is understand where our families are at and be able to close that gap, and that will be able to show us by the time that child reaches 2030 and they're 6 and they're in their first year of school, whether or not we are making that difference by doing that concerted more effort with some of the families that need our help and be wrapped around those families.
Thank you.
Thank you very much. Yes, please.
Thank you, Chair. Jill, in your presentation you referred to some workshops that we've started, which has taken a look at the Health and Care White Paper and what that means for place in the coming year. And everything that you've said around children up there, I think, was echoed for the whole system yesterday. So, Chair, we had a really good session of the System Transformation Board and other key people. We also had the new Chief Executive of the Integration Care Board there, which was good. And some of the feedback from that was it's one of the most systematic places that's looking at inequalities in this way. And I'm really excited about what we can do around the inequalities agenda going forward. And in the children's space, but in wider settings as well. So can't wait to work on it.
Thank you. Just a couple of quick ones, if I may. Is this going to be part of the Council's joint health and wellbeing strategy?
So absolutely, as I've mentioned, there's already the Best Start in Life as a key pillar within the Joint Health and Wellbeing Strategy, and also there's a Resilient Communities component to that strategy as well, and I see this as traversing across those areas. But I think this is about us understanding what are the other metrics that we'd like to pull out of that and to focus on as a collective in more detail, so it's absolutely aligned. And I know we've got a development session later on as well, haven't we, to actually reflect on how up to date and our Joint Health and Wellbeing Strategy is.
Page 4 of the report, you mentioned the partners aim to achieve arrangements which, and there's a long list, but there's nothing in there about the priority of listening to the voice of the children. So to what extent does that sort of permeate everything which you intend to do?
Well, absolutely, it's everything that we want to do. And when we refer around co-production in relation to our families and our children, that's about working with. But I think this is the read across to the Inequalities Plan that we're developing as well, and how we have a different approach to conversations with our communities, so that what is it that can be done by our families and by our children and young people. So I think, as I mentioned, this report was written a little time ago, and we're constantly evolving and making sure that all of these conversations are adding to that change. So if that's not reflected strongly enough in this paper, then it absolutely needs to be more so going forward.
Okay, thank you.
Yes, please.
Good morning. My name is Paula Mead. I'm the chair of the Safeguarding Partnership for Children and Adults. Thanks very much, Jill. I'm a great fan of integration. You very, very briefly mentioned Safeguarding Partnership. I think that I just hope that you'll take that very much into account, because we're doing a lot of work with that at the moment. We're integrating adults and children's safeguarding arrangements in a think family sort of approach. There's a lot of multi-agency subgroups doing work right from early intervention and prevention right through to the sharp end of child protection. And I hope that would be strengthened within the document, perhaps. I just felt that wasn't really coming over to me very much, other than one little line.
Take that on board fully. Thank you for that. And absolutely, been working with Graham Writer on looking at across all of the different partnership groups that are in existence. So I'm fully aware of that, the work that's happening in the Safeguarding Board. So apologies, it's not in the paper as much, but yeah, absolutely, it's all part of how we collectively work together across, from universal through to targeted work with our families. So thank you.
Gentleman there, thank you.
Hi, I'm Alistair Blair from Northumbria Healthcare. I suppose I was going to say we're all talking about perhaps some of the structural changes that are happening around us in probably the ICS and other bits, but what I would say is that you don't need permission to have place-based discussions, and I think that the people in the room can crack on and do without necessarily needing to wait for the structures around us to either respond or not. And I think it's much more important that we maintain and strengthen those local relationships with or without there being a macro structure that says you have to talk, you can talk anyway. And I think that's what we've actually already successfully done, and we need to build on that.
And actually, if I just come back again in relation to Safeguarding Partnership and what you've just said about not needing to wait for those structures to be in place, this isn't about creating another set of structures or another set of governance. This is absolutely about us working collectively, because we've all got the same shared interests of family and children at the heart of this. So it's about building on all of the structures that are already in existence, not trying to overlay another layer of governance in all of this. It's just trying to work as effectively as we can together. So.
Any more questions? So shall I move on to the next item? I think it's again led by Jill, I think. Aging Well Review.
Yeah.
So,
Agree the recommendations in the report.
okay, sorry, I have to ask, shall we agree on the recommendations on this one? Yeah, agreed. Thank you. Sorry, I was in a hurry to move to the next one. Thank you very much. Now the Aging Well Service Review.
Thank you. Liz has picked a good week to be on holiday, so apologies, it's me again. This is a shorter report than the last one. So really the purpose was to provide an update on the work to date on activities focused on ageing well, and ultimately to share a refreshed consideration of the evaluation that was undertaken back in 2019, and the recommendations were produced in January 2020, just before the pandemic hit, so we didn't really get to air them in as much detail as we would have liked to. So really the report is to bring them back to the foreground, to really think about that ageing well work that's taking place, and to put some proposals forward for you today to see how we get back up and running. So key points to reference within the report is that, just to note, in Northumberland we've got a disproportionately higher ageing population, which is even more marked within our rural communities. Overall, by 2020 estimates, we have about 25% of our population over the age of 65, compared to an England average of about 18.5%. So it's absolutely right and proper that we take a real interest in this proportion of our population. So back in 2019, there was a huge amount of activity underway. There was a board in place that was chaired by the then portfolio holder for adult health and wellbeing. But also in 2019, the Ageing Well team and function within the council transferred from adult services into the public health team and into the integrated wellbeing service. So that's why it felt timely to undertake this significant review that was produced by a specialty registrar within public health. So the review in the detail is in the appendices for you, but really the main findings to highlight But that overall, the programme was really well received and respected across the county. As well, the network that was produced was deemed to be really vibrant and reach into communities. And I know that's continued virtually during COVID as well, which was, again, well received. There's always further that we can reach, as I'm sure you can appreciate. Stakeholders valued the board, but I think these are some of the key things. They felt that it could have broader system representation around the table and also have greater accountability to increase its gravitas because it was a standalone board of its time. And also to potentially work towards having clearer outcomes and metrics to understand what difference this work was doing. So post-COVID, the team dusted off the evaluation. We've looked at it afresh. We've talked to a few key stakeholders, and we feel those recommendations still stand and are still robust. So the next steps that we're proposing is to refresh the board with broader membership, reaching out more into the likes of housing or north of Tyne, into the voluntary sector and such like, to make sure it's a system-wide board, to rename it a Healthy Ageing Board, and to develop a strategy and work plan that very much interfaces with lots of other work taking place, such as the developing dementia strategy, the physical activity strategy, the Inequalities Plan, because it's always tricky when we're working at population compared to condition specific or pathway specific, so we need to be very mindful and respectful of all of the other interfaces so that we don't duplicate effort in any way. So to develop that strategy and action plan, to set outcome measures, and ultimately for the Director of Public Health, Liz Morgan, to chair as an interim while we seek an independent chair. So the recommendations are for you to receive in the report around commenting on the evaluation, agreeing and supporting the refresh of the Healthy Ageing Board, to be chaired by the DPH, and then delegate the Director of Public Health in consultation with portfolio holder Councillor Patterson to recruit an independent chair. Thank you.
Yes, Wendy. Thank you.
Just to say thank you very much, Jill. I welcome this report. And just as a side issue, I attended in Powburn a few weeks ago an Ageing Well event, which was very well attended. And, you know, there was such a lot of interest. There was a little stall about scamming Northumberland Communities Together. Their stall was very popular. I just think it's a great idea for all smaller communities to have these events. And, you know, just to put on some tea and a cake and just get people in. It was really good. Really enjoyed it.
Questions? Yes, Glenn.
Go on.
Can you hear me? I'm just surprised that there isn't more mention in the report about encouraging volunteering, given the fact we need lots of volunteers to help us in all sorts of ways. Many people that are old, like me, still have a little bit of good in them and are able to be useful at times. I think we should do very much more to encourage and enlist the support and enthusiasm and motivation of older people. And that will be healthier for them, obviously, and good for the community. So we maybe do this in a different way, I don't know, Jill, but I think it should be something that's talked about more. Thank you. Sorry.
Just like to say, fully agree. I think that offer that older population can provide, whether it's informal caring, we know the role of grandparents, volunteering, absolutely we need, and this is why we want to refresh the strategy and the action plan and look at who's doing what and try and join it up better, because there will be a huge amount going on around volunteering, and it's just linking that all together more consistently. So thank you, we'll take those comments on board.
So without being difficult, can we actually add that somewhere to the recommendations?
Okay. So you want us to explicitly state that as one of the recommendations? Is that what? Okay. Right. Can we amend that a little? Yeah. Okay. Any other suggestions? Okay. Can I then propose to receive these recommendations, the 4 full bullet points, plus the inclusion of volunteering? Agreed? Thank you. Yeah. Okay. Next slide. Aging well review, and then health and well-being forward plan. It's pages 37 to 42. We are
One day living with COVID.
oh yes, yeah, that's correct. Yes, COVID update as well. I know there are 3 cheers for you, Jill. Sorry.
Because I haven't spoken enough today already. So just a brief verbal update. The most recent data is for week ending 29th of June, and we always use the ONS COVID survey information now as our most robust information. So current estimates are 1 in 25 people in England are currently infected with COVID. And we've also got estimates that have increased across all regions, highest in London, South West, North East and North and South West. And increases in all ages, with highest estimates prevalence in secondary school age and working age adults currently. From a variance perspective, the increase in cases is most likely to be because of the BA4 and BA5 Omicron variants, and estimates account that there for about 60% of cases currently. From a healthcare perspective, and colleagues, please feel free to come in, but it's in England, admissions and numbers in hospitals have increased since the end of May. However, numbers on mechanical ventilation do remain low, fortunately. In Northumberland, it's around 15 patients are admitted with COVID per day, around 70 in hospital, but that's not to say that they're in hospital because of COVID, and I think that's a really important message to highlight. People are being tested and then finding that they have COVID whilst in, so it's not about the fact that they're poorly because of COVID while they're in hospital. And staff absences remain the biggest issue for us across the healthcare setting, so it's managing business as usual rather than the actual COVID cases as such. Vaccinations, we remain one of the highest uptakes of COVID vaccinations within Northumberland. Overall uptake for the spring booster was about 85%. An interim JCVI advice has been issued regarding the autumn booster, and it's looking like residents and care homes for older adults and staff, frontline health and social care, all those aged 65 and older, and adults 16 to 64. From a comms perspective, there's no additional national comms. They are starting to look at the COVID and flu combined comms for autumn and winter. So there's just recently been media calls looking at that. And there is going to be a new Listen to Liz video coming out on social media, because just to maintain that the communications are exactly as they were. If you're feeling poorly, stay at home. If you feel comfortable wearing face coverings, if you are in close proximity to people, and please do get vaccinated. Thank you.
Thank you very much. Yes, please.
It's just really to agree, the biggest impact of COVID at the moment is in staffing. Unlike other industries, if somebody is asymptomatic but is COVID positive, they're not coming into work for obvious reasons. And that is having quite a significant effect on healthcare staffing, both in primary and secondary care. So although we are not seeing large numbers of people who are unwell with COVID, if there's 1 in 25 people in the community, there's going to be 1 in 25 people attending accident and emergency, for example. So, you know, the figures don't necessarily reflect severity of illness, but the impact is predominantly in staffing, and we're having to cancel lists because people are, for example, testing positive at short notice. The surgeon can't operate, etc. So it has disproportionate effects to healthcare as providers, rather than it being a burden of the disease in terms of the way it's presenting. But that is not insignificant, as we're all trying to recover, both in primary and secondary care, with the legacy of the pandemic.
Any other? Yeah. Yes.
Sorry about this. I just wondered if we might think about moving our meetings around a bit to go and visit key partners, and perhaps hold our meetings in different locations, occasionally to County Hall. I think that would help understand, and I think it would be interesting. And I wonder if you could think about that perhaps with Graham. And then the second thing is, we talk all the time about place, in inverted commas, and how our role is key in working within our communities along with partners. I don't know whether the Harrogate Trust are present, are they today? All right, good. But I just wonder if we could just maybe have just like an interactive sort of session, rather than being, being presented with reports, just around place and how we, as a council, and how are our partners working together? Are we doing it well? Are we, what issues are there, particularly in Northumberland, and so on? So it would be sort of more of a round table kind of discussion, which I would really like to learn from, if that's something you could think about, perhaps.
Definitely take it on board, your rotating meeting. Yeah, that's right. I think following this meeting, we have an informal discussion session as well. So that is primarily catches your second question, suggestion, basically. Yeah. I know, yeah, but so we do have an informal suggestion. Maybe I'll use this opportunity to invite all of you to stay for the informal, development session, we call them. And so we can informally interact, exactly the point you made, and then come up with some ideas with no video recording or anything, so that would be good. Yeah, the point taken, Glenn, both are. Are there any other questions? Okay, thank you, Jill, for all the three reports. And okay, now I think we can move on to item number 7, which is to look at the items for future meetings. I think they are all listed up there. There is only one thing one change I would like to point out is that living with COVID, we want to make it less prominent in the future meetings, because it's there in kind of in the background all the time. So if the agenda items are heavy, then we may not consider that item at all. So that's what we discussed. If that is okay with you. Any questions on that future agenda items? No. Okay, thank you. Urgent business. Any other urgent business? Yes, please.
Thank you. It's just to let board members know that the volunteering community sector are having a health and wellbeing conference in September, and Sam Allen will be the keynote speaker. So if anybody would like to come along, there are a few places left. And if you get in touch with me, and I'll make arrangements for you to get a place there.
Thank you very much. Any other? Thank you. So the next meeting will be 11th of August, 10 a.m. Unfortunately, we're in County Hall. So we may not be moving at that stage, but we will definitely take your suggestion on board. Okay, and there's going to be a small break, isn't it? Before the informal session, or?
I wonder if people want to move, get a coffee, and just come back, and then we can give a bit more attention and be willing to speak to each other a bit more in this next session, if that's okay.
Okay, thank you. So the meeting is officially ended. Yeah.